Hey everybody, this is Tammy Nash with Dallas Voice and DVtv. I'm here with Israel Luna, also with DVtv Live, and this is Dr. Masri with North Texas Infectious Disease Consultant. Dr. Masri is going to tell us about herself a bit. We're going to start over, I'm sorry for that, and about the North Texas Infectious Disease Consultants and about COVID-19. There we go.
So I'm one of the infectious disease doctors. We practice here at North Texas Infectious Disease Consultants with the Baylor campus. A big part of our practice is seeing HIV patients.
Mm-hmm.
We also see transplant patients and HIV patients who have received transplants, which is more and more common these days, thankfully.
Yes.
And we provide teaching for Baylor University Medical Center residents and medical students, and we also see their inpatients consults.
Okay, now you had been telling us about coronavirus, what that is, how it's a category, a family.
So coronaviruses is a family of viruses that can cause disease in humans and animals. The disease that was described in humans is usually a respiratory illness. The community strains, there are multiple community strains that are usually in the community that cause mild respiratory illness.
Mm-hmm.
The current novel coronavirus is a new the virus that has been described now and genetically sequenced. And we know that it's about 80% genetically very, very close to SARS. So the name of the virus is SARS-CoV-2.
COVID-10.
And the name of the disease is COVID-19, and that's based on the WHO definitions and the CDC definitions.
And the 19, I may be wrong, but I believe the 19 stands for 2019.
Exactly, 2019, where the late December 2019 were the first cases that were described in Wuhan, China.
Okay, in Wuhan. Now, you work a lot with HIV patients and transplant patients, so your patients are high risk.
Yes, absolutely.
Tell us how this affects people with HIV.
So, and of course, nowadays, hopefully, our patients with HIV are all on antiretrovirals, so we hope that their immune system is robust. That being said, they're definitely in the high risk category. We don't have data yet from the studies that were published because this is ongoing and evolving very quickly. We don't have data specifically regarding HIV patients with COVID-19 because this is still, again, very, very new to us. But we would assume that patients who have issues with their immune system, especially patients who have HIV and have received a transplant, are definitely in a higher risk category. So I think for our patients, the recommendation is please make sure you're taking your antiretrovirals. That is the best thing you can do to make sure your immune system is robust enough. And then we follow the CDC recommendations on a daily basis and adjust because it's an evolving situation.
You know, like you said, you also do transplant patients. If transplant patients often are on immune suppressing
Transplant
medications.
Patients are always on immunosuppressive medications because we basically do not want them to reject the graft. The downside of that is that they are at higher risk for infections and unusual atypical infections that you would not possibly see in somebody who's not immunocompromised. So they are in the highest category risk of in general, high risk population.
You know, and a question, I know some folks who take, not because of transplants or HIV, but take some medications that affect your immune system, like those who have autoimmune diseases.
Yes, a lot of the patients who have autoimmune diseases, have ulcerative colitis or rheumatoid arthritis, are on medication that will, yes, improve their symptoms greatly, but unfortunately will also affect their immune system.
Okay. Is there a recommendation if somebody like has a long-term chronic illness that they take one of these medications, would it be a good idea to not take that for a little bit, or should you never take your meds?
It would be a discussion on a case-by-case basis with their physicians because some of the it's always everything is about risk and benefit. So I think I don't want to give a general recommendation. I think it should be a conversation between the patient and their physician, and should be a decision to be made on a case-by-case basis.
Okay.
I have a question. So, like, for example, right now, the distance where we're sitting for all of the people watching,
Yes.
there is a distance. What are some of the things that we can, all of us over here, everyday people, can we do? I mean, is this helping by this
Yes.
distance?
So I think it's a great question, because I think we all need to talk about social distancing and how it will help us protect our more vulnerable population, including the elderly, patients who have chronic illnesses, diabetes, chronic heart disease, chronic lung disease, who are at very high risk for, and our Asian HIV population, who is also have more and more comorbidities, because they're living longer, which is great, but they also are in their 60s and their 70s, and they are at higher risk. So we know from the experiences of other countries that social distancing works. And what social distancing means is that you want to minimize unnecessary exposure. Basically, don't go out to restaurants, don't go out to bars. Do the things that you really need to do for your daily activities, get your groceries. Don't buy enough for you to keep at home, but let other people have enough, because the food chain is not in danger. But if everybody keeps buying frantically, then it's going to be a problem. So I think we went from, this is nothing, to panic, and we need to be extremely cautious, because this is a big deal. But the way to be cautious is minimizing social gatherings, minimizing the number of people you see, keeping 6 feet distance if possible when you're outside, limiting your outings, limiting gatherings. Don't travel if you don't have to, and making sure for families of our patients who have higher risk factors, being very cautious about unnecessary travel, and keeping your distance. Work from home if possible. We know that this is not easy for everybody to do, but if you can do remote work from home, that will help. So I think what we're trying to do is encourage people to remember, yes, for 80% of the population, it will probably be a mild illness. We have 20% that we need to protect. We need to make sure that we're doing everything we can to minimize their risk. And we want to make sure that the hospitals will not get overwhelmed with sick people who need to be cared for at one specific time. So what we're trying to do is what we call flatten the curve, where we know that some of those patients are going to need ventilators, are going to need critical care providers and infectious disease providers and equipment. So we are trying to minimize the number that will come at once. If we can do that, if we can flatten the curve where we have a steady number of patients who are being admitted to the hospital and cared for, then our system will be able to manage those patients. But what happened, unfortunately, is in Italy is that the system is being overwhelmed because way too many people are very sick at the same time.
Yeah, it's that graph where they show the real high peak.
Exactly, the graph that would peak. And basically our job is, as much as possible, is to flatten that curve. Now we will still have a significant number of cases, and we will see more cases moving forward. That is a given. But our job is to make sure that if we are able to flatten that curve, then the system will hold, and we'll be able to provide care for the sicker patients. And some of our patients will not be sick enough to be in the hospital. They can care and just be at home, self-isolate, and they will have a mild illness. So they stay home, we call them, double check on them, and make sure that they're checking the temperature, make sure that if they develop more significant symptoms, then they will call and be admitted to the hospital. But for the higher risk population, elderly, chronic illnesses, HIV, we need to try our best to protect them from the infection, because it will be a more severe infection to them.
I think it's really important what you just said a couple of minutes ago to everyone out there who is going to the grocery store and everything, is that there is no shortage of food. There's plenty there. So, just to make sure to take what you need at the moment, because you can still...
you can go back...
exactly.
Go back and get more, think of other people, think of maybe elderly who don't have help, who will need to go and get their own supplies. So buying in bulk, I mean, it would be reasonable to have enough for a week or two at home, but then remember, the groceries markets are going to restock, so it's not, and we're not going to, you will still be able to go get your groceries and do your daily needed activities, but it's not now, it's not the time for social gatherings and bigger events. I mean, we have to be careful.
Yeah, and folks, I'm sorry, but if you're going to go through 5 or 6 giant things of toilet paper in a week, then you have worse problems right now than COVID. You need to check on something else. But I want I see a lot of people on social media. It seems like people are at extremes, and they're not here in this middle. It's either, oh my God, everybody's going to die tomorrow, or it's nothing. It's not
polarizing everything.
Yeah, and it's. But I mean, we need to make sure the people on this end understand that this is not nothing. This is not a common cold or the flu.
No, this is not a common cold. The mortality rate is significantly higher than the flu as far as we know right now. So it is a serious illness, especially for the higher risk population. And our job is to make sure that everybody understands that and explain why the precautions that are everything that's being done now, why we need that. We need people to understand that social distancing is important, that minimizing travel is important, not only to protect yourself, but to protect the higher risk population.
Right.
And so that's, yes, I mean, that's very, very important because, and I think the reaction we have is interesting because we wanna convey the seriousness of this, but we also don't want to cause panic because panic is not going to help. We need to stay calm, follow the guidelines, the CDC has a great website, www.cdc.gov, that has updated recommendations both for physicians, for us to see what's updated from a physician standpoint, but also for the general public. Okay. Recommendations for do you consider travel, recommendations on what to do if you feel like you're sick. So those are fairly accessible online. It's important not to listen to science and listen to the people the experts who know what they're saying, and not be overwhelmed about what you're reading from websites, and you have to be careful where you get your information from, and I think that's very important message. That's
absolutely, there's a lot of stuff going on. I know I'm doing this, I'm sorry. There's a lot of stuff going around right now about, the press has created the hysteria. You have to, from my perspective, you have to know the difference between reliable media sources and just people who are
maybe voicing their opinion, but may not be expert in the matter and might not be really saying the right information.
Right. So just because somebody tells you there's nothing to this, don't believe them, if they've got a degree.
I don't think anybody should say this is nothing. I think that would just not be. It's not helpful. It is something that is serious. We're not saying it's not doom and gloom, but we're saying that it's serious. Take precautions to help protect yourself and other people.
And I think that the way it's kind of changing a lot of things, like me as a small business owner, there is a change in behavior that I've had to start doing with people that come to my studio or my business, because now, just like when we greeted you, do we hug, do we shake, do we do the elbow, what do we do now?
I think, this is gonna change the way we live our lives for the next weeks, possibly more. But I think it's important to learn new behaviors. So shaking hands now is not a good idea. Maybe do an elbow bump or just greetings in another way. Keep distance from other people. Don't hug, don't kiss. The greetings will have to be different. Europeans are going through that now.
Oh, yeah.
We have to do it too, and that's to protect all of us, basically. It is mainly droplet. So the transmission is basically through droplets.
Cough in my hand, and shake your hand.
So basically the routine things, don't cough in your hand. If you want to cough, use a tissue and dispose of it very quickly. Make sure you're washing your hands frequently, and I think that's a very, very important message. Washing your hands frequently for at least 20 seconds. So not just 20 seconds, count for 20 seconds, and that will help minimize transmission.
I'm glad that you said that because that's what I've heard, and I'm glad that there are certain facts that are out there that are actually true, like the 20-second rule.
True. Yes, the 20-second rule is true, and we encourage our patients to wash their hands frequently. Avoid touching your face frequently, which is harder to do when you think about it.
Yeah,
but
you're
I
like,
think,
oh.
but I think that washing your hands multiple times a day, frequently, definitely before you eat, after you go to the bathroom. I mean, just increasing that on a regular basis in your daily life and making sure you do it for 20 seconds will help.
In saying that, what is the biggest misconception for everybody watching that is just flat out not true, that's making maybe people panic?
I think it's not so. I think there's a lot of misconceptions. I think we go from it's nothing to I need to freak out, and I think the major misconception is that we're running out of food, and there's because people are going to the grocery stores and buying in bulk, and I think that's the major misconception. Like, we have better ways to deal with this, and yes, you should have a reasonable amount of food at your home, but I think that's the major misconception. It's like suddenly this rush to go buy stuff to keep at home, where that's really not where the problem is. I would rather you stay home and have enough and just not expose yourself. Just minimizing unnecessary outings is the major thing, and now we see that with the government. The guidelines are changing quickly. So it was less than 50 people. Now it's less than 10 people. So no guidelines less than 10 people.
Wow.
Less than 10.
No gatherings of more than 10 people. This is the recommendation. So, and I think that's where our focus should be. Don't go to. Unfortunately, and that we understand that this is going to affect restaurants and bars and and businesses, but we have to prioritize health. So please order in or take out. So help those businesses in a way that they can survive through this crisis. But we're not saying the food is not the problem. What we're saying is the big gatherings are a big problem, and I think that's a big misconception.
I don't know if there's been enough information on this where you can talk about it yet or not. But someone had said, and I mentioned this a while ago, that the antiretroviral meds that people on HIV are using may be good in combating this?
So there are, so there's no, to be clear, there's no FDA-approved treatment for COVID-19. However, there are multiple ongoing trials, which basically we're trying to figure out what might work. And one of the medications that is currently used in some of those trials is lopinavir, ritonavir, which is Kaletra, or darunavir, which is Prevista, Norvir, or Prescovix, which are protease inhibitors that we use for treatment of HIV. And the rationale is that those protease inhibitors will inhibit an enzyme that may be also effective for SARS-CoV-2, the virus. So it's ongoing. We don't really know if it's gonna work, but yes, there are ongoing trials for
it is the possibility.
Yes, other medications. There's a new antiviral that is available also through the NIH. It's a clinical trial. So we have ongoing trials with the multiple different medications. One of them is a protease inhibitor that is used in HIV patients.
I do have a question. One thing that I've heard, and I want to know if it's true or not, is that with the spring coming and the heat coming in, that's going to help kill it. Is that true?
I think we should be cautious about that because we don't really know. I think in general, coronaviruses have not survived well in the heat. That being said, this is a novel coronavirus, and it's difficult to predict what's going to happen in the next few weeks. We know for sure that we're going to see more cases in Dallas, in Texas, in the United States moving forward for the next few weeks. It's difficult to predict how long it's going to last.
Okay.
Let me check some. I'm checking to see if there's anybody watching.
Oh yeah, there's a lot of people commenting, which is good. Turn it all the way down.
Sorry for that. Turn down. I'm sorry, y'all. Okay. Edna Jean says, in total total controlled panic. I'm watching all day and tuned in.
Well, while you're reading some of the comments, I have another quick question. Is I think one of the things that may be happening with people going to the grocery stores and just going nuts is I think that they think that at any moment the government might say, quarantine yourselves, do not leave, no one's going into the street at all, and that's like
fear.
the survival.
But I think based on what was done and was successful so far in places like South Korea, Singapore, Hong Kong, is that all non-essential businesses, yes, probably will have to close, but then grocery stores, gas stations that have remained open in other countries where you can still do your necessary activities for your daily needs, for food and gas, if you are going to have to still work.
Mm-hmm.
So that is an evolving situation, so it's unclear how it's going to evolve. But again, I think the supply will still be there, and grocery stores will probably stay open, because this is something that we'll need. This is not it's not a luxury, it's not a restaurant, it's not something that we're doing for like a social event. This is something that people will need for their daily lives.
And we were talking about misconceptions, and I've seen there's a couple of things, and one of our listeners here, watchers, is there something we can do if we suspect we may have run into someone that has the virus? Gargle, salt water washes, the whole gargle with salt water thing.
Yeah, there's no scientific evidence to support that. I think what we are recommending is have a discussion with your primary care physician at first. If you feel like you have symptoms, call your primary care doctor and discuss over the phone, and they'll have they'll ask you questions and kind of assess whether or not you're at risk. If you feel like you develop symptoms and you're thinking that your symptoms are severe, the recommendation is before you go to any ER, you need to let them know, because they need to be prepared in case you were exposed to someone. And again, that's kind of a case-by-case basis. But if you feel like you have symptoms and the symptoms are severe and you're developing shortness of breath, then you need to call ahead of time to give the ER physicians and staff time to know that you need to be isolating from other people. You need to try and put a mask on yourself if you're feeling ill, and letting people know ahead of time, self-isolate at home until EMS arrives.
The mask thing.
Yeah, that's what I was about to ask about the mask.
I have heard that if you don't have the virus, if you're not ill, wearing the mask is really not going to do you any good. It's if you're ill, you do that.
Yes. So basically the CDC recommendation as for now is that putting a mask if you're not feeling ill will not help you. However, if you have respiratory symptoms and you're coughing and you think that you might have to go to see your primary care doctor or to go to any health care facility or hospital, then yes, you try to cover your mouth and your nose, because you are helping to prevent the spread.
Right.
Rather than if you feel well, at this point there's no recommendation to wear a mask at this point.
Okay, I know you're very busy, so unless you have wait, let's see.
Do you have any questions?
Yeah, because the mask is pretty much like if you're sick and you're trying to not give it to anybody else,
yes,
right?
Because the mask, if you're sick and you're coughing, the mask will minimize the droplets that you send out,
right.
So it will help prevent the spread. However, if you feel well and you're not symptomatic, the CDC recommends now that there's no indication to wear a mask.
Okay.
One of our watchers here is asking if you could speak just a little bit again. Our community, the LGBTQ community, you know, for us, our bars have long been our community centers. That's our family.
Yes.
And we still have a lot of people who are saying, "Oh, it's not. Why are you doing this? It's not necessary." So somebody's asking, "Can you speak to that?"
Actually, that's a very good question, because unfortunately, it is necessary, and we are encouraging people to stay connected through social media, maybe Facebook, FaceTime, even happy hour with FaceTime, like things that you can do while you're at home, still connect with your friends and family members, but not go to bars, because it is when you have a big gathering, that's that's how the virus is spreading. So it is important, and we understand it's not easy. Bars and restaurants are big social places where people gather and have their social, and we're social beings, we need to connect. So we are trying to kind of recommend, if you cannot connect through being in one place, you can still connect through social media and have a family dinner through social media, or have a happy hour doing that. And I think because you want to, and our population is on actually higher risk, so we want to make sure that they know that for now you really have to hunker down.
Yeah, and I'm going to ask you just to do a little quick roundup, what you should do, what you shouldn't do, just very quickly before we let you go. Stay calm.
Wash your hands frequently for 20 seconds. Minimize unnecessary outings. If you can work from home, do that. If you cannot, then this is, I mean, we know that many people will not be able to do that, but minimize exposure to other people. Definitely do not have big gatherings of more than 10 people. That's the current recommendations. Okay.
Dr. Al-Masri, thank you so much. We appreciate you taking the time to do this. Folks, we're going to put this video, it's streaming live, but we're recording it. We're going to put it on the Dallas Voice website so that you can go back and watch it and listen again. Make sure you know what's going on, and make sure the other people around you know what's going on, and that you get good, solid, scientifically based information.
And what was the website you had mentioned?
The CDC website, if you Google it, is www.cdc.gov. Has excellent information. It's updated daily for the general public to review and assess if they have symptoms, what to do. The Dallas County also, but I think the CDC website provides excellent general information on what we need to do on a daily basis.
It's cdc.gov.gov. And on DallasVoice.com, I know that a lot of people in our community make their living in the bars and in the restaurants, and you are concerned and have reason to be concerned about your economic status. We already have one link on our website that might offer some emergency relief for people in the hospitality and service industries. I'm trying to verify another one right now, so we'll get that information to you. And again, thank you very much.
Thank you.
And thank y'all for watching, and y'all be safe. Thank you.